Hello, everybody. My name is Jordan, and I work for the Center for Civic and Public Policy Improvement. We are a public policy agency that focuses on affordable housing, healthcare, criminal justice, and education. And we are going to interview someone today on our education focus. So Aaron, you want to introduce yourself first?
Hi everyone, my name is Aaron. I'm an intern with the Center for Civic and Public Policy Improvement under the CMHouston internship program at the University of Houston, where I'm currently a junior studying political science. Education, one of the CCPPI's focuses, is something that I have also been focusing on most recently, and so I'm looking forward to this interview today.
Thank you, Aaron. Yeah, as he said, education is one of our focus areas and something that we're specifically passionate about and drove some advocacy around during the Texas legislative session, and currently with funding under the Build Back Better Act is child care subsidies and universal access to preschool, which both of those things are essential to support children's brain development for our country's economic future and for racial and gender equity in our workforce. So with that, we are super excited to have Ramona Williams with us today from the Children's Museum Houston. Ramona is the Alexander Specialist for Early Literacy Development and Special Learning Needs. And Ramona, to start us off, can you first tell us a bit about yourself and your background, how you got into this type of community work and early childhood education work?
Absolutely. Thank you so much for having me this morning, Jordan and Aaron. It is a pleasure to be here with you. So yes, I am the Alexander Specialist for Children's Museum Houston. I've been here over 2 years and I have, however, worked with children for over 20 plus years. It is a passion, I know, right? It is a passion of mine to be able to serve children in the capacity that I have been able to serve. And when I think about it, going back to even my childhood, I was always that kid who wanted to play school and I had to be the teacher. So being able to fast forward a little bit, once I graduated from college, I worked with children who had just different disabilities. Then I went on to work with at-risk kids in Pasadena. And I think that's where some of the thought processing shifted to know that, you know what, a lot of our children are struggling in reading. So I thought about it and I said, you know what, I'm going to become a reading teacher. So a few years into my education career, I decided I wanted to have a larger impact. Became an administrator in the education system. And I still noticed some of those same things. Kids who had academic challenges, kids who were struggling in reading, who had social, emotional issues. And I thought there has to be something that will somehow decrease or minimize the challenges and the struggles that they're having. Because here we're talking about in middle school. So is there something that could happen at the foundational level that could change this and allow these children to go on to be successful, not only students, but people in life in general? And so that landed me here at Children's Museum Houston, where I get an opportunity to work with 2 initiatives. Well, we do a lot, of course, here at Children's Museum Houston, but specifically 2 initiatives that actually provide foundation for infants and toddlers around early brain development. And it actually also encourages parents to be involved in their child's lives in a way that is very intentional.
Thank you, Ramona. Yeah, I love your story, and I love how working with children of different ages brought you to the work that you currently do on the very, very little ones.
Right.
So because it is such a foundational time, which we'll talk more about. But first, can you tell me what it is that you enjoy and what do you love about the work that you do?
You know, what I really love about the work that I do is being able to see those light bulb moments for parents A lot of times we don't even realize that, hey, what I'm doing is actually helping my child build their brain. And so we're able to give them the strategies and the tools and the skills that will give them the support that they need to interact with their children in such a way that will allow them to further engage with their toddlers, engage with their children. And I love to know that parents can be empowered in that way. And what typically happens is when the parent is empowered, then we see the children are able to benefit from it. And then once they go into school, they have a better foundation for being ready for school.
Yeah, that's amazing. Really supporting them in, creating an environment where they're more prepared to go
Right.
into like the formal education setting. And I said this the other day when we were talking, but I love the strength-based approach that you all have, and like recognizing the parents are already probably doing a lot of things that are supporting their children's brain development without maybe even realizing it. And you're giving them those knowledge and kind of honing that and more and giving more skills.
Right.
So we know that children start learning immediately at birth, and that a really important time for a child's brain development is from birth to the age of 3. So in your context, the work that y'all do, or you do, can you talk a little bit about how crucial it is for babies and toddlers to learn, and the kind of learning that they need, as we were just saying, before school?
Absolutely. So from birth to age 3, the brain undergoes rapid development. And the brain is actually expecting and is prepared to be shaped by the experiences they have in these early years. And actually 80% of brain development happens, or brain growth happens, in the first 3 years of life. So what a child hears, what they learn, what they experience plays a major role in their future learning. And it also has an impact on future behavior, future health. So when we think about it, what happens in those early years is actually what forms the foundation for what's to come. And I like to say it like this: when we know that a child is spending those 0 to 3-year-old years at home with their parents, that makes them, it makes their parents, of course, their child's first teacher. And I think to think about it that way is an honor, to know that I am the one that will be able to impart those things in my child and nurture my child's brain development before they even enter into school. And also, let me say, in our work, we have noticed that a lot of parents, once we start to provide them with these strategies and skills, will tell us, I didn't know that it was possible. I thought brain development actually happened once they entered school, or brain development happened once they started talking. So once we are able to give them that information, they know, hey, this is where I can start, and I can insert myself into my little one's early childhood brain development.
Yeah, I think that's really like a key piece, where it's like, a lot of your work is with parents and caregivers and, people that are raising children. It seems almost more than with the little ones, because you're giving them the skills to then take them home.
Absolutely.
So in your experience with brain development, which, thank you for giving us that context and that background, it's really important. What are some of the best interventions or strategies that you see to support families, the parents and the caregivers, for young children's development?
So I think one that is very simple, it costs nothing, is what we call serve and return. So serve and return is an everyday interaction. It can happen even before a child is talking. And we have to remember that child development is a very highly interactive process. And so we can look at serve and return as being a volley that happens back and forth between the child and the parent, or the child and whomever the caregiver is. And so let's say if the child laughs, then the adult laughs. If the child is pointing to something, then the adult will give a response that maybe is labeling or saying, oh, that's a red truck, instead of just allowing the child to point, and then that interaction stops there. So serve and return is one of those things, like I said, it's interactive, it doesn't cost anything, but it's something that definitely goes to help support building the brain of baby. And the other thing that we have Welcome Baby, we also have Basics Houston, and these are programs that go to support brain development in infants. And so being able to be aware of programs such as these, so that way that they can interact and learn the skills and the strategies and add them to their toolbox that they might have as they're interacting with their little ones.
Yeah, that's great. And I mean, you all have multiple programs that support parents and support that type of early learning. So Erin has some questions for you specifically about the two programs that you run, which you just briefly mentioned, Basics and Welcome Baby Houston.
They do. So like you said, you oversee both Welcome Baby and Basics. So I was wondering if you could kind of just tell us a bit more about both of those programs and, kind of what you do.
Absolutely. I'll start with Welcome Baby. So Welcome Baby is an initiative that actually started back in 2017. We started with making only 1,000 bags, and now we are making 10,000 bags that actually go out to different organizations in the community. And so how it works is an organization will partner with us. We'll do a training with the organization, and that organization will provide us staff. Well, I won't say provide a staff. We will train their staff to become persons of trust. And the whole idea of the persons of trust model is to leverage the trust relationship that a staff member or organization will already have with the families that they serve. And by the way, let me mention the families that we're talking about. We're talking about families who have infants ages 2 to 9 months. They live in Harris County and are eligible for some type of government assistance. So we're talking about WIC, Head Start, or CHIP, any of those. And the thing about Welcome Baby as well is it is a set of resources, interactives that come in a cute little bag that we provide to the organizations, and they convey the message of Welcome Baby. So when I was speaking about the persons of trust, the person of trust is super important, because the idea of Welcome Baby is not to receive a bag of resources, it's to receive a message that you are your child's first teacher, that you play a very critical and crucial role in their early brain development and early literacy, and just to empower parents in those ways. And so that message is then conveyed through the persons of trust that we've trained from different organizations. And the beauty of this particular project, it takes everyone. CMH, we actually don't distribute bags from our location. It is the partners that we work with that are our distribution partners that are so instrumental in making this effort possible.
It's really incredible how you're able to kind of, use all a bunch of different areas of the community and, to kind of fulfill
Absolutely.
your really.
Absolutely.
And so with Welcome Baby and Basics, do you have a way of measuring how effective the organizations are being? And then if so, can you kind of give us some examples of some successes that you've seen in the past?
Absolutely. When our parents receive their welcome baby bag, one of the things that we have them do is complete a pre-survey. And then our organizations work with them as well to have them do a follow-up post-survey. And in the information or the data that we have received back, it has been very consistent over the years that we have implemented Welcome Baby itself. 44% of those who were surveyed, who submitted a pre-survey and a post-survey, said that they have improved their literacy development. 39% have improved their reading frequency with their infants, which is amazing because kids need to hear talk, they need to hear language, they need to hear books being read. 83% have gained a knowledge of different ideas that they can do, different activities that they can do with their infant, which is important because after Welcome Baby is, they have utilized the information in Welcome Baby and they're able to start synthesizing this information. We want them to be able to use it just almost as second nature, like it becomes a part of them. And 50% of those who actually have participated in Welcome Baby said that they have shared their ideas with other families that are in the community, which is something that we also want. We want this information to be out. We want the awareness to be there. And let me also tell you about Basics Houston. So Basics Houston was brought to us by Christy Rangel with the Houston Health Department. Sorry, my phone is ringing. With the Houston Health Department. And she partnered with Dr. Ronald Ferguson in Boston, who is actually the founder of the Boston Basics. We then, she was very instrumental in bringing the Boston Basics to Houston, and now we have the Basics Houston. And so CMH has actually partnered with the Houston Health Department and developed a curriculum for the basics that we have now turned into what we call fun shops that allows parents to have access to the principles that are known as the basics. And there are 5 principles. And in these fun shops, there are 1-hour sessions where families come, and it is not just for parents, but it's for the parent and the child. So they interact, they bond, they are engaged together in literacy, sing-alongs, and our staff here at CMH actually models for them the activities that go along with the basics 5 principles, which are maximize love, manage stress, count, group, and compare, talk, sing, and point, read and discuss stories, and explore through movement and play. Currently, all of our sessions are virtual. Of course, we know why our sessions are virtual, but all of the sessions are free, and all of the resources that families need whenever the session is being conducted is also given to them free. So parents can either pick them up, we either mail them to them, or if we have an organization that we can partner with and have a hub site where families can go and pick up their kits or their resources from there.
I have a quick question that we didn't prepare, but for basics, is it, does it have the same income requirements or eligibility for, assistance programs, or is it just open to anyone who wants to sign up?
Yes, it is open because the basics can help any family. They're literally basic things that families can do. And you heard what those 5 principles were, and it really doesn't take a lot. And that's the thing. We want it to be simple. We want it to be easy, and yet it is powerful for families. We are currently in near Northside, Gulfton, and we are working our way into the 3rd Ward area.
Awesome. Sorry, go ahead, Aaron.
Excuse me. So I know you mentioned earlier about, having to have some things virtually. So I was wondering if there are any challenges that you face kind of setting up, and especially more recently, as I'm sure you have, the pandemic, and then how you continue to kind of deal with those challenges in order to kind of still follow the mission of these 2 initiatives that you have.
Yeah, our biggest challenge with this came with the pandemic. We were rocking and rolling. We had been in near Northside and Galton for a complete year, and we were 3 weeks away from literally launching in Third Ward when the pandemic happened. And the thing about the fun shops, they are meant to be interactive. It's beautiful to see them face to face because you see those in real time light bulb moments for parents. You see the interactions and the engagement when they are there participating in the fun shops in person. And so it took us a little bit of time, but we were able to pivot and provide them in a virtual manner. We will continue to do that as long as we need to do it in order for parents to still be able to receive the skills, the basics, the knowledge that I think is really important when it comes to early brain development and early literacy. But I think the biggest challenge is let's say this, and I don't think I mentioned this, is technology can sometimes be a challenge because it's happening virtually. And we know that some families just don't have that equal access to technology, which could potentially be a hindrance. But other than that, I would say just the idea of just moving it from the how do I want to say it, face to face, going to virtual, and I think was probably our biggest challenge. And then kind of stopping the process where we were and trying to move forward into that Third Ward space.
Absolutely understandable. The pandemic, has messed up so many things. So I wasn't not really shocked to see, that you weren't kind of insulated from that, But it's great to hear that, you're still kind of pushing through it and still following.
Yes, absolutely.
So speaking of, your kind of goals with these initiatives, how might someone who, hears about these and really believes in like the ability for them to make meaningful change, how would someone who wants to get involved with either basics or Welcome Baby go about exactly doing that?
Very easily, they can email me at ramona.williams@cmhouston.org, or can simply give me a call, 713-535-7206. And I would love to speak further with an organization who believes that there is some synergy between CMH and the family and their organization, especially if we're serving the same families. I think there can always be benefit to add layers to what our families who so deserve to have information on early literacy, have information on early childhood development. And they can also visit our website for more information. And if a family wants to register for a fun shop, they can go to Children's Museum Houston, CM Houston, so our Children's Museum website, cmhouston.org, and go to our outreach tab, and they'll see Basics Houston as well as Welcome Baby. And then the other thing I have to say is that the Houston Health Department created a beautiful website for the basics. So you would go to the basicshouston.org. There are a ton of resources, information, videos on the five basics principles, as well as you can get in contact with them for more information as well.
Perfect. Thank you so much for that. And as we kind of wrap up, when you take a step back and kind of look at the bigger picture of things, how do you see the work that you do kind of connecting to policies that kind of go around, access for early childhood learning?
I love this question because I think the role that we play in the bigger picture is the awareness that it brings to the importance of early brain development, early literacy as it's related to early childhood education. One of the things that I said earlier was that We had some families who would tell us, I didn't know. I didn't know that I could start this early. I didn't know that brain development, early literacy didn't happen when my child got to school. I didn't know that I was my child's first teacher. And so I think the awareness, especially for parents, because they have to be a part of that process as well. So giving them that awareness gives the possibility to potentially position them to also advocate for what they know is important. And then the last thing that I would say to that is, if I have learned the skills and the strategies that I need, and I'm implementing with my child when they're, let's say, birth to 3, and now it's time to pass the baton to someone else, let's say the education system, right? I want to feel as if I am passing it to a system that I know is going to continue the work that I have been able to learn and pass on to my child to help grow their brain and help to provide them with that strong foundation. And so I think awareness and advocacy is the connection. I almost see it as a step over, or running a race and running as hard as you can, and then here's that baton. And so we need that, those policies in place. We need that advocacy, I think, from our parents. I think it's important.
Absolutely, and I absolutely agree about what you said about passing the baton. Really, it's really right. It's correct. So thank you so much, Ramona, for your time, and Jordan.
Thank you.
Yeah, thank you, Erin. Thank you, Ramona. Yeah, I really enjoyed, the second half of our conversation today and getting to listen in. And I really like your answer on the last thing, Ramona, because yeah, it's y'all are helping create advocates for their children once they go into the education system, which we know is quite flawed and has a lot of there's a lot of work to be done there. And so when people who are fighting for their own child or the child that they're caring for, right, are at the forefront of those conversations, and they're the ones talking to their elected officials, and they're the ones encouraging people in their life to go vote on school board elections, of which we have one this Saturday, December 11th, HISD runoff. Side note, yeah, like that makes a big impact. So we thank you so much, and for all of the work that y'all are doing. Children's Museum Houston is obviously beloved in the community, and we're happy to be able to uplift some of y'all's outreach programs, which are just as important as all the fun that's to be had when you go to visit the museum.
Thank you so much. And I appreciate your time today. And I also appreciate what you guys do as well.
Thank you.